Hello everyone and welcome. I'm excited to be here with you today. Today we're kicking off with episode 6 of our series. This is our cover slide, so I just want to briefly introduce what we'll be exploring. We'll go over the main topics and key points, giving you a clear idea of what to expect in the upcoming slides. So, let's dive in and get started. Alright, let's discuss decerebrate posturing, which is a critical sign we need to recognize in clients with head injuries. When Nurse Linda is caring for a client exhibiting decerebrate posturing, it indicates a severe brain injury involving the brainstem. Now, the key characteristic of this type of posturing is that both the upper and lower extremities are extended. This means the arms and legs are straight out, with the arms usually pronated, and the legs extended, which can look quite rigid. It's important to differentiate this from other postures, like decorticate posturing, where the arms are flexed but the legs are extended. So, in this question, the correct answer is that decerebrate posturing is characterized by extension of the extremities after a stimulus. This reflects a more severe brain injury and indicates that the brainstem is involved. Recognizing this pattern helps us understand the severity of the injury and guides our immediate intervention and monitoring. Remember, this kind of posturing is a sign that the client needs urgent medical attention. It's a crucial part of assessing neurological status in head injury cases. When we talk about the extension of the extremities after a stimulus, we're referring to how our muscles respond in a very specific way. Essentially, when a stimulus is applied, say, a tap or a quick stretch, the muscle reacts by extending or lengthening. This is part of our reflexive response, which is designed to protect us and maintain balance. The key point here is that this extension is a direct, involuntary reaction to the stimulus. It's important because it highlights how our nervous system quickly coordinates muscle actions to respond to external stimuli. Understanding this helps us see how reflexes work as a fundamental part of our motor control, connecting directly to our overall ability to maintain posture and respond to our environment efficiently. Decerebrate posturing is an abnormal motor response that we often see in clients who have severe brain injuries. It's typically associated with damage to the brainstem, specifically below the level of the red nucleus. This posture indicates a significant impairment in the brain's ability to regulate muscle tone and reflexes. When we observe decerebrate posturing, it's a sign that the injury is quite serious, involving neural pathways that control muscle relaxation and tone. Recognizing this response helps us understand the severity of the brain damage and guides our approach to treatment and prognosis. Overall, it's an important clinical sign to be aware of when assessing neurological function after a brain injury. Let's take a closer look at decerebrate posturing. It's characterized by a rigid extension of the arms and legs, which is quite a distinctive sign. When someone exhibits this, you'll notice that the arms are extended and internally rotated, meaning the palms might be facing inward or downward. The legs are also extended, and usually in a position called plantar flexion, where the toes point downward. This posture often happens in response to a painful stimulus, acting as a reflexive response of the nervous system. Importantly, decerebrate posturing indicates more severe neurological damage compared to decorticate posturing. It suggests that the damage is likely at a level closer to the brainstem, which is a critical point to keep in mind when assessing neurological function. So, understanding these key features helps us gauge the severity of a neurological injury and guides our response in clinical situations. Let's look at some common misconceptions. First, upper extremity flexion with lower extremity flexion is not a recognized posturing pattern. So, if you see both the arms and legs flexed, that doesn't fit the classic postures we associate with brain injury. Next, upper extremity flexion combined with lower extremity extension actually describes decorticate posturing, not decerebrate. This distinction is important because the two postures indicate different levels of brain injury. Finally, flexion of the extremities after a stimulus again suggests decorticate posturing. This is a key point because decorticate posturing is characterized by abnormal flexion responses, especially after stimuli. Understanding why the other options are incorrect helps us better identify and interpret posturing patterns, which is crucial in assessing the severity and level of brain injury. Let's take a moment to clarify these terms. Decorticate posture refers to flexion, which means the limbs are pulled toward the core of the body. Imagine the arms bent up, like a person curling inward. On the other hand, decerebrate posture involves extension, where the limbs are straightened away from the body, almost as if the person is rigidly reaching out. Remember, these signs are important indicators when assessing neurological function. Decorticate indicates a certain level of brain injury, often above the brainstem, while decerebrate suggests a more severe injury involving the brainstem itself. Recognizing these postures helps us understand the severity and location of neurological damage, which is crucial for diagnosis and treatment planning.